Hello, everyone. I am back and I got the tea for you. Nursing school, nursing school, nursing school. I'm done with mental health. First, I want to get into the clinicals. I want to talk how the clinicals is. You know how I said before, my first clinical was very hectic for me and was always on my feet. This second clinical is not like that. It's very slow. It's only about 10 patients to a floor, one nurse and two CNAs. I'm not necessarily with the CNAs, I'm more necessarily with one patient a week. So, what we were primarily focusing on in this second round of clinicals is the head to toe assessment, just getting new patients every single week, and then going over the level of consciousness, going over the chest, listen to the breath sounds, the heart, the abdomen, looking at the feet, checking for edema, whatnot. So my patients have been very laid back, very sweet. I had this little old lady where she can kind of move around for herself, but she can barely hear. But she was like somebody that's really like your grandma, and she was helping me through the whole process, telling me about her past experience, any history of falls, any past surgeries and whatnot. So she helped me through my assessments, and I don't have my book with me, but my teacher is grading it. There's this big book where we have to write like every page. It starts with the brain, it starts with the GI, it just goes on in each page about the entire body system, and I have to write down basically if she's abnormal or normal. If there's any abnormal findings, I have to recheck this patient another 2 hours and make sure if it's still abnormal or normal. So that was like the only thing that's really difficult about this clinical is I have to keep going back to this patient and making sure, everything's a-okay. And so it's been going well with that. I don't have any problems. My grades have been good clinical wise. Mental health, y'all. Remember how I said mental health was 4 tests? The last video with my hair looking crazy, I took my second test and I got an 80. I took my third test and I made a 58. Y'all, when I tell you I did not study because I was so frustrated. Like I felt like even like damn near on the edge, like having a mental breakdown because there were so many tests, there were so many clinicals that I had to go to, skills, and going to school Monday through Friday, then going to work right after. Like I don't have time for nothing. I don't have time for nothing. So I felt like with that test, I said, you know what, let me just read a little something, go through it. No, I failed it. I'll never do that again. And to come to find out, probably only two people passed that test. Nobody studied. Nobody studied. And remember, like I said, we have 4 tests. So you can only really fail, barely even that, one test. And so for the fourth test, y'all, we had a week. No, we had 2 weeks to study for that test. And then we had a week, no, 2 weeks and a day because we had like a tornado. Where I'm staying, yeah, for y'all, I live in Oklahoma. So we're big on tornadoes, storms around this season. So we were off on 2 weeks and a Monday, and I catched up on all my studying, like studying to the point where I was crying every single hour because like I didn't take a break from my book. Because if I knew I failed this test, that would have been the end of me. End. And listen, I don't know about y'all. I'm not going back. This is what I need to do now. I need to make some money now. Okay? So I ended up passing that test and I did very good with that one. And then everybody got in the classroom. They made it. And then I was catching up on my NCLEX questions because remember how I said we have NCLEX questions, 100 questions that we had to turn in each month. And then we did a thing called dementia care. So we had to go through these modules where we can get certified in dementia. And it basically makes us good on our resume. But these modules took so long to go through because you had to watch these videos. You had to basically do like a little homework or something on it and stuff like that. And it was just a whole bunch, but basically it was a test grade. So I was working on that. And while everybody's having fun, talking, yapping, there was this one girl that I was like a little close, but she's like an older lady. And I always had her as a partner with skills. And she came in, she grabbed her bags, and she was like, I'm about to go. I said, what do you mean? I'm about to go. I didn't pass the test. Y'all, when I told you, like, I was shaking. I was shaking because this is the second person in our class. The second person. And she was like, what happened? She didn't do well on the fourth test. And remember, with our ATIs don't hurt us. It just makes it better. So since she didn't do well on her test, the ATI, she needed to make a 3 in order to pass the class. Because remember, 70% is what's going to hold your ass, you know? So she didn't make a 3. I think it was below that. And she grabbed her bags. And everybody, it was just like a family at that point. Everybody just circled around her, gave her a hug and whatnot. And it was very sad because, like, I really want my people to be successful. And she felt like a failure. Like, her other close friends was telling me that she was saying that she was kind of suicidal at that point. And I was just, like, hugging her close. Like, I told her, I said, please, like, don't quit. I was trying to hold my tears back and whatnot. Like, please don't quit. Please apply again. Because with this school, y'all, say she finished nursing fundamentals, she finished her clinicals, they'll give her credit if she comes back, meaning she doesn't have to retake that class. So I said, please come back in the fall, try again. You know what I'm saying? Like, don't let this mess with you. They're gonna give you credit. And she was, okay, I will. And it was just the saddest thing ever. It really was. It's the saddest thing ever. They will let you go if you're not passing. So she left, and then we were immediately on to the next. We threw that mental health book and onto med-surg. So we had a med-surg, and they only gave us, okay, let me put it like this. Monday was the mental health exam. Tuesdays was our skills. Wednesdays was our lecture. No, I'm sorry. I'm getting mixed up. I'm sorry, y'all. Monday, remember I said we didn't go to school. We had the tornado thing going on, so we had an extra day off from school. Tuesday, we had the exam. Wednesday, we had a skill. Thursday, we had lecture. Friday, we had a med-surg exam. And we just got the med-surg information on Tuesday. That is not enough to study for no test. That's not enough. She was like, oh, that's nothing but memorization. When y'all get in the med-surg, it's going to be a little bit more detailed. We looking at the diagnostic values. You looking at certain parts of the body's the system. You know, you need to know the infections and diseases and whatnot. It just gets a little more detailed than a little bit of fundamentals and some mental health that anybody can study on. You know what I'm saying? And so I failed it. I made like a 63. And I asked everybody else, y'all trying to make myself feel better. I said, do y'all fail it too? Y'all fail it? They was like, yeah, we failed it. We didn't have time to study for none of it. So actually, when I was studying for it, I was just betting on a 50. Because I know I can bring up a 50, from anything. And I got a 63, so I was like, okay, that's cool with me. So now I'm working on my next exam, and that's not too bad. And actually, I have a tutor. Like I said, this school comes with a tutor, so I'll go see my tutor as much as possible. If I'm paying for it, that's what I'm gonna go to do, is be my tutor. And I like my tutor better because she generalizes in it's like higher I don't know what she did. It's like some higher education, but she does master the science of testing. She like knows the loopholes to passing. As long as you understand the concepts and what to do out in the work field, she understands the concepts of how to get through this the easy way except the hard way. Like, she's one of those people where forget the book, this is what you need to know. That's it. And I love her teaching method. It gets me through everything. And so I've been studying for the next exam, skills. I'm sorry, I'm writing down everything so I can give y'all the tea. Skills, we've been working on intravenous catheters. Been doing it by the hand. I passed that skill. We've been doing, working on like drip factors. We've been working on, I forgot what that thing, them little, I'm sorry, I don't know the names. We were just checking out. It's like the skills where you put the little leads on people. We've been working on that. What else have we been doing? Skills, I've been doing some farm skills as far as checking off on certain pills, knowing what the pills do. Well, we've been checking off on basically pharmacology skills and, utilizing our 3 checks. So first they'll tell us like it'll be this type of card. This is the card y'all gonna have in LPN school. It's a drug Davis card. So this one is I don't know which one this is. We're gonna say this one's metformin. Metformin is gonna tell me what the drug does, the interactions, what route I need to take it, what actions I need to do before I give it to the patient as far as checking for the blood pressure, checking for labs and whatnot, just doing an overall assessment before I give this drug to the patient, and monitoring and what implication did I need to do as a nurse. So basically, the nurse would tell me, your doctor has an order for about these 5 things, right? I want you to pull this out for me. And then I want you to call me once you pull it. So my first pull is the first check. I'm pulling out the drawer, putting the pills in the cup, or I'm getting like some cream or something like that, put it in the cup, and I have to know the amount that I'm putting in. So it's going to tell me in the book, or the book that she gives me, I flip it over, it say 0.5 this or 0.7, and I go by that. Or I'm drawing something, I'm putting a little air in the vial, and then I'm withdrawing how much I need. With this skill, they make us outside of the room, they make us cap it back, and then we get our professor. We have to go over it again with the professor so she can know that you got the milligrams right, and she make sure that just basically overall that you ain't gonna stick nothing in patient that's not supposed to be in there. You gotta do a second check with the nurse. Okay, so she says, okay, you good to go. Now I want you to go tell the patient what you about to do. So I gotta do my skill kind of like you do with any overall school. Knock knock. Hey, Mrs. Action Annie. It be this fake person they give us. They like, hey, Mrs. Action Annie, I'm the Shayla. I'm the student nurse, and I have some of your metformin, your cream. I have your inhaler, and your doctor has prescribed this for you at 8 o'clock here. Is that okay if I give that to you? Yeah, that's okay. All right, well, I'm going to come over here. I'm going to wash my hands, or I'm going to put on my gloves, and then I'm going to pull the bed up to working height, make sure everything's safe around. All right, so first I'm just going to give you a shot or something like that, clean the space up. And then it'll say intramuscular or whatever. It'll tell you what route you need to put it in. You wipe it, you let it air dry, you never blow on it. You give them the shot. All right, put that in the red container. All right, I got some of your metformin here. I got some water. I got you drink a little water, okay? All right, you look good. Put some water in there. Give her the pills. Make sure she tolerated it well. You give her an inhaler or something for her asthma, 2+. Put it in. Or if it say you need to put the little nasal stuff in it, it'll say 2 drops. Okay, you put 1 drop here. It'll say hold the nose. 1 drop here. Nose. 1 drop here. My bad, my phone went off. Okay, so yeah, it'll say 1 drop here, 1 drop there. Okay, do it again. Okay, you're good to go. You feel good now? Oh, I feel way good. All right, well, on a scale of 0 to 10, what would you say your pain is, Oh, my pain is here. Okay, right down. All right, well, I'm going to come check back on you in about 30 minutes. Make sure you tolerate everything well. Grab my items, make sure it's in the right stuff. Put the rail back up, put the bed back down, wash my hands, and go document. That's how skills really go for farm. Or, med-surg skills. Pretty easy for now. And then, what else? But now, since I finished up, I'm still on my clinicals. And I finished my mental health. We're on med-surg and we're on farm. And mind you, med-surg and farm, we are doing that together now. So that's it's about to probably be bottom for me come June and July. They said the only time we're gonna legit get a break or when it's gonna slow down is in September. So they call this phase the heart of the program. So y'all gonna have to pray for me. Like, but I'm making it. I notice with studying now, my dad used to always tell me, you might not like it, but the only way you're gonna really succeed is if you enjoy what you do. You need to enjoy every page that you read. You know, you just take every word and use it as extra knowledge, and say that you enjoy learning about asepsis techniques. You enjoy learning about new pills that you'd never learned before. You know, feed new things to your brain that you've never, never obtained that knowledge a day in your life. I mean, you just get smarter and smarter. And what I would tell you guys, from January to now, I feel like I'm more of a nurse. January to now, all that vigorous work, literally they can throw a patient at me and I think I would just know about what the heck to do, And even when it comes to September, and once we finish med surge and we get more into the disease process, I really feel like I'm gonna have it 100%. So now I want to talk about, I've made new friends. You know how I said I was keeping mostly to myself in the beginning of the year. Majority of the black girls, really, the ones that, it was like a tight circle, they invited me to go to this place called Main Event. And so we were celebrating that we completed first semester, because I am done with the first semester of nursing, and then we're on to the second semester. Right now I have a week off, so we have a 1 week summer break and then we go right back to school. And so we went to Main Event, and I said, I hope y'all drink, because I'm about to go buy a bottle, because I'm telling you, I need a break. So I bought a bottle. We bowling and we drinking, we having fun, we eating our appetizers. We did some laser tag, and we did this bungee jumping thing. It was so much fun. Then we went out to eat again because we was like tipsy. It was so fun. And then it was like, hey, how about we go to the movies? Like, we've been choosing things that's only like less than $10 to $20 because we all on a budget. Like, and I like that now, like, because they understand my struggle. My other friends, like, I can tell you right now, they don't necessarily understand what I'm going through right now. Like, it's been a tough spot. Even my parents, like, they know I can't see them as much. They know I have to work, and they just don't quite as much understand. Well, at least my mom, because she missing her little baby, and I just don't have time, But my friends, like, when they want to go out to the club or something, or go out of town, or plan a trip, like, if y'all ever look at my other YouTube blog, it was nothing for me to plan a trip. It was nothing for me to get a plane ticket and be out. But now that I'm not working, now that I have to put all my focus into studies, I think people are just not getting that. And I just want y'all to prepare. Like, it might be some downtimes with your friends, you know what I'm saying? And they're gonna be feeling some type of way, but I don't care. I'm worried about my future, my success, and they're gonna see that when I graduate. So I can't worry about it. So that's one thing. But yeah, I made some new friends from school, and they understand. So we're gonna go to the movies. We're gonna see like Ma. I guess it's Ma, that black lady. I hope it's scary and it ain't no comical stuff. But y'all, this semester, it was alright. It was alright. I ain't gonna lie, I shed a few tears, for real. And I'm just ready to get back to my life, because this was so not my life like a year ago. Like, I could get up and do what I want to. I would spend money how I want to. And now it gave me a huge reality check. And it's also teaching me how to be like a better saver, balling on a $20 budget, you know what I'm saying? But it's getting lit. It's getting lit, y'all. What else am I missing? Oh, this is my med surge book. Look at this. And remind you, the people that either in the past have dropped out or they've already completed the program, they would either donate the books or they would be selling they would sell the books for the price that you see on Amazon or Chegg, right? So I waited till, because I believe every LPN program is around the same time. So I check a week before our new semester starts in med-surg. This book was about like 80 to $120. All right, say it was like 100 in stock. That week it was only down to like 10. So that lets you know that it was multiple schools that are doing this program at the same time. So Amazon and Chegg cut that price down drastically because they're trying to sell those books. And so the price was going down to $30 to $40. So no, it was $40 to $50. Yeah, it was about $40 to $50. Some of them was $60 for brand new. And so the girl that was selling her book, I said, since it's used, you got a little writing on it, it's a little janky on the end, trying to get my seller voice on. I said, these two sites right here is willing to give me something new for like $50. You know what I'm saying? Just give this used book for me to like 30. Okay. I said, ooh, bargain. So imagine me not paying 80, 120, or 60, 50, whatever how much it was. I paid this book $30. Everybody was buying their books from the bookstore. You never buy your books from the bookstore. Never. Girl, that's some goofball stuff. And Amazon sometimes mess up on my shipment, and my last 2 books was free. Because I sure be calling the customer service department, excuse me. And then another girl. Okay, so I'm going to do some questions real quick that I've just now seen on my YouTube. Let me see. It says, hello, any YouTube videos that will prepare us for math? I'm scared now. If you're talking about the AccuPlacer, what I took to get into the LPN program, what I did was on YouTube. I typed in AccuPlacer math test prep. It should be the second video, and it should be a guy named Maths Got Served. And then I'll put in the link below. It should be a total of about 3 to 4 videos of what's going to be on the AccuPlacer. Even the scenario of the question, it'll say little Timmy had a cupcake. Usually on the test it'll say little Timmy had a T-bone steak or something like that. And it'll tell you like basically all the numbers in the graphs are very similar. It's just the scenario is very different. So I advise you just study that. It's exactly really the same as the test. Study it. And remember, I only had 24 hours to study for that test in order for me to get into that program. So if you're planning on doing a program now, I advise you just to study it as much as you can and make the highest grade that you can. Nursing school has been very competitive. And I forgot to tell y'all that what our schools now, and there's another girl that asked me where I'm from Oklahoma. What our state is doing now, I'm sure it's more states, but we're having some of our community colleges come and see us because our school is accredited. Remember, whatever school you go to, make sure that they're accredited. You got places like Platt or something like that, and people not getting no credits or anything like that, or they can't go to another school or get their points because that school is never accredited, and you can't necessarily move up in the game because they don't count it. Get you a school that's accredited. Let's see. Community colleges are coming to our school. We had 2 schools, one from OSU and one from OTRIP. And the professor was stating that since the baby boomers are dying, there's going to be a huge nursing shortage. Well, there is one that's going to be even huger. So they're basically trying to move. They're trying to hurry up and get people to be nurses. They're trying to encourage people to get in the game. But again, you need passionate workers. And nursing field is very competitive. What's good in that when people are barely getting accepted in these programs? Like, you got to be the best of the best, basically. So I'm put like this. We have OTRIP. They probably take about 30 students per whatever their semester is, fall, spring, whatever. Now they're trying to take 70 because that's how bad they're going to start needing people. But you got to think about it. They need staff. That's the only thing that's hindering most of these schools that are trying to implement this now. They need staff. That's the only thing they're struggling. So OTRIP has staff, and OSU OKC has it now, and they've upping how many people they're taking in. Now, since the schools are accredited and these schools are conjoined, because how I go to Francis Tuttle, if you don't know, if you apply for the associate's program at one of those schools, you didn't get in, the schools will send you to Francis Tuttle, the Votech, to get your LPN. Once you pass your LPN, you will have an automatic slot for the associate's RN program, right? And so that's a good deal. That's what most people do. Me, I want my bachelor's. I'm gonna do my LPN and BSN, not LPN or RN. I'm just gonna knock it out that way. But most people that do is the LPN or RN and whatnot, they'll have an automatic slot. Now, most people that probably didn't get an automatic slot, they since they up the score on how many people they need, if they passed in May, and these are people that started in fall, if they passed in May, they're going to immediately start them in August. They're going to put them before all their people at that school that are working towards their nursing. They're going to put them before them because you're already going to pass your NCLEX. You've already had experience. So don't let anybody tell you that getting LPN is a waste of time. Trust me, instead of being some of these nurses that's waiting years on end to get in the program, no, you're an LPN, you're a nurse, you're already making money, and they're going to put you ahead of all of them because they need people with experience. So don't let them tell you that LPN ain't nothing, baby. These schools is looking for LPNs first. They looking for people that already got something behind their name. It is what it is. Dog eat dog world. Let's see. What else? Somebody said, any tips for nursing school? Again, save as much money as you can. Anybody that's toxic in your life, cut off your boyfriends, your family, anything, cut them off. Pay off anything that is hindering you. Your car, your phone, like I said before. One girl said that we have uniforms, no uniforms. No, we don't have any uniforms at the school. While we're doing our schools, we can just wear our regular clothes, but when we at clinicals, we have to be in our uniform, sharp. Let's see. And there's a lot of y'all that asked me to wish y'all good luck on starting LPN. Sincerely, more than good luck, I know y'all gonna get in. I'm gonna just be like that. I'm that type of person. I say yourself, I know I'm gonna get into this program. I know with hard work and dedication, I'm gonna get myself into this program. I know you can do it. I did it. Hell, I did it in less than a week. So you can definitely do it. If I missed any questions or anything like that, please let me know. I'm going to do my best to try to reply back to as many as I can to y'all. Instagram. Y'all can follow me on Instagram. It's DESHAYLA. I think it's YY. Don't mind me. I'm going to put it in down below. Like, I'm hot right now. I'm very hot. So I'm going to put everything that we discussed in the bottom. If y'all have any more questions, put it down. I don't go back to school till Monday, so I should have enough time to answer questions if I get this uploaded in a timely manner, because it's just hard to upload and edit and whatnot. But thank you so much for you guys watching. I'm going to do my best to get another video out. It's just not much to really film because I'm in public spaces and I can't take my phone out everywhere. But I'm going to give y'all as much tea as I can. And good news, 6 more months to graduation. 6 more months. So we've made progress, y'all. Y'all have a great day.